So hi all, in this video we are going to see details of femoral triangle, which is a triangular depression seen in the lower limb. So we are going to see only the important aspects of this region. So to talk about this femoral triangle, as I said before, it is a triangular depression. So we have got our lower limb. So in that lower limb, so we have got thigh and leg. So we have got medial and lateral aspect of thigh and leg. Now this femoral triangle is going to be placed in the upper one third of the thigh. So this is the thigh region. So in thigh region, upper one third is occupied by this triangle. So this is the triangle we are going to get in the upper one third of lower limb. So this is what the femoral triangle, which is contributed by two muscles on either side, and this triangular depression only we are going to deal with. So this area is called as femoral triangle. Okay. So about this triangle in detail we are going to discuss now. Here you can make out this triangular area have got its base above. So this is the base of this femoral triangle and the apex. So this part is the apex. So this apex, it is directed downwards. So apex is seen below, base is seen above. So this is the region which we are going to deal in this video. So to talk about this, we are going to discuss in two different categories, such as we are going to see about its boundaries. So mainly we are going to deal about its boundaries and its contents. Only the important aspect we are going to deal now about boundaries and the contents of this femoral triangle we are going to deal. First we will move on to the boundaries of this femoral triangle. So to talk about the boundaries of femoral triangle, we have got, already we know, we have got base and apex. So boundaries of femoral triangle. So this femoral triangle is bounded again having a triangular area. So as I said, it have got a triangular depression where apex will be placed below and base will be seen in the upper aspect, right? So base is seen in the upper aspect, apex is directed below. And again we have got medial border and the lateral border. So this is the medial border, this is the lateral border, and above we have got base. This is the base and this is the apex. Clear? So about these four boundaries we are going to deal first. Then after we have got along with this. So boundaries we are having, what we have seen now is we have got medial border, lateral border, apex and base. So these are the things which we are going to deal now. Then later we will see about the covering of this femoral triangle, that is roof. So we are going to deal along with this roof, and in the lower part we have got floor of the femoral triangle. So about floor, what are the muscles contributing for it, we are going to deal. So about boundaries we are going to see about two borders, apex, base, and also roof and floor. First we will deal about the boundaries. Here we have got apex and base, right? Now talking about base, in the upper one third of thigh we have got in the medial aspect a bone called pubic bone. So we have got a bone, that is pubic bone, body of pubis. From the body of pubis, in the upper border we have got a tubercle. A small elevation will be seen, and that elevation is known as pubic tubercle. So this is pubic tubercle. From the pubic tubercle to the anterior superior iliac spine, we have got ilium bone or part of hip bone which have got a spine, that is anterior superior iliac spine. So from the anterior superior iliac spine to the pubic tubercle we have got a ligament extending. So a ligament will be extending like this. So this ligament is called as inguinal ligament. So this is inguinal ligament. So this is the ligament responsible for the base of femoral triangle. So we are talking about femoral triangle now. So this femoral triangle is contributed mainly by the four boundaries, that is base, apex and lateral border, medial border, along with roof and floor. Now we are talking about base, which is contributed by inguinal ligament. Moving on to the borders. So I hope base you understood. We will move on to medial border. So medial border, it is contributed by a muscle. We have got anterior compartment of the femoral triangle contributing, we have got anterior compartment, medial compartment and posterior compartment of thigh. Among that, the medial border of femoral triangle is contributed by medial compartment muscle. That is, we have got a muscle called adductor longus. So we have got a muscle in the medial aspect, that is adductor longus. So this is the muscle seen in the medial aspect. Same way, lateral border is contributed by anterior compartment muscle. That is, we have got a muscle called sartorius placed over here. So this is sartorius, which is an anterior compartment muscle. So medial border is formed by, or medial boundary of the femoral triangle is contributed by adductor longus medial border. So this is the medial border of adductor longus. So this medial border of adductor longus is going to contribute for the medial boundary of femoral triangle. Same way, lateral boundary is contributed by sartorius muscle. In sartorius muscle, again we have got medial border. So this medial border is going to contribute for the femoral triangle medial boundary. So this is how we have got femoral triangle boundaries such as medial border of adductor longus, medial border of sartorius, and then we have got our inguinal ligament placed, and the apex is contributed by these two muscles, that is adductor longus and sartorius are going to approximate in the lower part, that is apex of the femoral triangle. This is base, that is nothing but inguinal ligament. Hope you understood. Now we will move on to roof of this femoral triangle. So to talk about the roof of femoral triangle, we have got fascia lata, that is we have got deep fascia in the thigh region which is called as fascia lata. So we have seen apex approximation, lateral border by sartorius, medial border adductor longus. Now we are going to deal about roof. Roof is nothing but deep fascia of the thigh, that is fascia lata. So fascia lata. After skin, superficial fascia, we will approach deep fascia, that is contributed by fascia lata. Now we will move on to floor. Hope you all understood these 5 boundary. We are moving on to floor of the femoral triangle. So floor of femoral triangle. Okay. So to talk about the floor of femoral triangle, we have got again 4 muscles contributing. So as you know, the triangular depression is present over here. So this is triangular depression, which is contributed by all the boundaries we have seen. Now we are talking about the floor of femoral triangle, which is contributed by again some muscles which are going to form femoral gutter. This is medial and this is lateral. Now you know, we have got adductor longus muscle, medial border we are taking as a boundary. So the whole of the muscle will be placed over here. So this is adductor longus. We are talking about floor muscle. The first muscle from medial to lateral we have got as adductor longus. So this is adductor longus. Adductor longus. Okay, adductor longus muscle. Then after that, from medial to lateral if we are going, we have got one more muscle seen just lateral to adductor longus, that is nothing but pectineus muscle. So we have got a muscle seen over here, that is again a muscle called pectineus. So this is pectineus muscle. Pectineus muscle. Then again we have got on the lateral aspect of pectineus, a tendon will be seen, a muscular tendon, and this is nothing but psoas tendon. So this is psoas tendon. Psoas. Okay. Psoas tendon, and the lateral aspect we have got one more muscle, that is iliacus muscle. So this muscle is called as iliacus muscle. Iliacus muscle. So I hope you understood. Floor is contributed by 4 muscles from medial to lateral, that is adductor longus, pectineus, psoas tendon and iliacus. Okay, so these are the floor muscles contributing. Now we will move on to the contents. So boundaries, these are the things you have to know. Floor, we have finished that. So floor, roof, medial border, lateral border, apex and base. Now we will move on to the contents. So talking about the contents, so we are going to deal about contents of femoral triangle. Okay, so we are going to deal about contents of femoral triangle. So to talk about contents of femoral triangle, we have got 7 important contents. We are having 7 contents in the femoral triangle. So as you know, we have got sartorius, adductor longus, inguinal ligament. Okay, this is the apex. Now we are going to see about contents. The first content among the 7, the first content which we have is femoral artery. So this is the first content which we are going to deal. So that is femoral artery. So we are going to deal about femoral artery. So this is then artery which is seen in the femoral triangle. So we are calling it as femoral artery. So the femoral artery is coming from the abdomen, going to pass behind the inguinal ligament, then reaching the femoral triangle. So it is having a straight course over here and it is going to reach near to the apex of femoral triangle. Then after it is going to continue in the adductor canal of the thigh, which is seen in the medial compartment. Later it is going to continue as popliteal artery in popliteal fossa. So this artery, which is a continuation of external iliac artery. So we have got external iliac artery, right, which is a continuing as femoral artery here in the femoral triangle. Then it is going to terminate as popliteal artery. On its course, it is going to give many branches. About the branches, we will deal later separately. Now just to understand, we are talking about contents, femoral artery. Then second structure what we have is femoral vein. So accompanying the artery, we have got femoral vein. So we are going to deal about femoral vein. The femoral vein is seen medial to the femoral artery. So this femoral vein is seen just medial to the femoral artery. So it is also passing like this. So popliteal vein is going to continue as the femoral vein, which is again going to continue as iliac vein. So we have got this as femoral vein. Hope you understood. So we are talking about the contents of femoral triangle. First structure which we have is femoral artery. Medial to that we have got femoral vein. The main artery which is draining over the femoral vein is great saphenous vein. So that you can mention. So this is the great saphenous vein. Okay. So we are having femoral artery, femoral vein. 2 contents over. Now we are moving on to the third content. The third content is femoral nerve. As you know, we have finished artery and vein. We have got the next structure as femoral nerve. So about femoral nerve, this is a nerve which is seen lateral to the femoral artery. So femoral nerve, it is coming from the lumbar plexus and going to continue in the femoral triangle by dividing into 2 divisions. It have got anterior division and the posterior division with its branches. So this is femoral nerve. So this is the nerve which is seen lateral to femoral artery. Femoral vein. So this is femoral artery and this is femoral nerve we have got. Along with this, we have got some inguinal lymph nodes seen. So we have got the fourth structure as deep inguinal lymph nodes. Inguinal lymph nodes which is seen in the femoral triangle upper part, that is near to the inguinal ligament. So here we have got collection of lymph nodes, that is nothing but deep inguinal lymph nodes. So this is the fourth content we have got in femoral triangle. Moving on to the fifth content, that is nothing but again a nerve. So we have got one more nerve seen over here, that is lateral femoral cutaneous nerve. Femoral cutaneous nerve. Okay. So this lateral femoral cutaneous nerve seen lateral to femoral nerve, a small part of it will be seen. A small part of it will be seen present in the femoral triangle. So this is lateral femoral cutaneous nerve. Hope you understood. Now we are going on to the sixth structure which we have. The sixth structure which we have is genitofemoral nerve. So genital branch of we have got femoral branch of genitofemoral nerve, genitofemoral nerve, which is coming from again the lumbar plexus. In that femoral branch will be seen just above the femoral artery. So here just above the femoral artery we have got this genitofemoral nerve, which is a femoral branch of genitofemoral nerve. Okay, so this is the sixth structure we have got. Then one more thing which is present here is fibro fatty tissues, that is seen all over the femoral triangle, that is fibro fatty tissue. Okay, so we have got one more structure seen over here, that is fibro fatty tissue. Okay, so that is seen all over here, all over the femoral triangle we have got content as fibro fatty tissue. So these are the contents of femoral triangle we got to know. I will repeat again. First one is femoral artery, second femoral vein, third is femoral nerve, then we have got deep inguinal lymph nodes, then two more nerves, that is lateral femoral cutaneous nerve, genitofemoral nerve, which is a femoral branch of genitofemoral nerve. Then we have got fibro fatty tissues present over here. Okay. Now along with this femoral artery we have got its branches also. So those branches we will deal separately. We have got around 7 branches for this femoral artery again, and we have got some tributaries of femoral vein present over femoral triangle. There are one among that is great saphenous vein, and we have got branches of femoral nerve seen over here. Now we will move on to, so these are the things you have to deal in femoral triangle. So we have seen clearly about the boundaries and the contents of femoral triangle. Thank you for listening.